Aneurysm in the brain is a weak area where the blood vessel gets thinned out and they balloon out. And once there is a ballooning of the blood vessel, we call it as an aneurysm. Once it bleeds, give rise to a very complex brain hemorrhage, which is called a subarachnoid hemorrhage, where 30% of the patient die before reaching a hospital. Another 70% of the patient with a brain aneurysm rupture with a subarachnoid hemorrhage, when they reaches the hospital, half of them they can again bleed within coming 3 weeks. Once the aneurysm has bled twice, 99% of the patient they die because of such a bleed. So aneurysm is considered as a bomb in the brain. Now when there is an aneurysm in the bifurcation, that is when the blood vessel is going and dividing into two, at that level if there is an aneurysm, we call it as a bifurcation aneurysm in the brain, and they are often complex to treat. Today we will show you a very large aneurysm, arguably the largest aneurysm that is endovascularly treated in the state of Andhra Pradesh. That is about 19 millimeter wide neck MCA bifurcation aneurysm that is treated with a stent assisted coiling, which we are going to show you today. This is the angiogram, which is showing there is a large bifurcation aneurysm at the level of the left MCA bifurcation, and this is basically the patient who came to us, a 70-year-old lady with a subarachnoid hemorrhage, and the DSA angiogram, which is showing there is a large left MCA bifurcation aneurysm. We will do a stent assisted coiling for this patient today. We are slowly navigating our microcatheter, and then we will try to go through this branch which is coming out the neck of the aneurysm, so that we can put a stent across the neck, which will be very useful for us to create a scaffold and for the endothelial adjacent to happen. So I have given a very complex shape to the wire like a SIM2, and I will try to go into this branch to complete deployment of the stent. So here I have gone into the branch which is actually coming out of this neck, so that the stent can be deployed across here, which will give protection for the coil mass, as well as it will help us in future endothelialization. So you can see this beautifully, the catheter has gone inside. I'm deploying the stent. It is a self-expandable Atlas neurovascular stent, which is a 3:21 in dimension. This is the distal end of the stent, which is just opened, and we just come across the neck of this aneurysm, and this is the proximal end of the stent, which I want to open in the M1, and this is how it is done. You can see the proximal end open beautifully. So now this is a stent, and this is the coiling catheter, which is just coiling this large 19 millimeter aneurysm, and we will serially coil and try to exclude this aneurysm from the circulation. Now we can see the aneurysm is excluded from the circulation, the stent across the branch which is coming up the aneurysm, and there's a good amount of coil mass. And once you look at the DSA cerebral angiogram, we can see that the aneurysm is beautifully excluded from the circulation with the rest of the branches patent. So this is a complete treatment done for this ruptured left MCA bifurcation aneurysm. Thank you.